So now Sankranti has just gone. The elections are over in Maharashtra, and we have, you know, those who have won, they are very happy. Those who have lost, there's a lot of anger and all. So let us understand what is anger, and let us see how homeopathy would help in treating and in helping us in getting the remedy because of anger. Now you see, anger, joy, happiness, timidity, sadness are basic reaction of life. Anger, everybody passes through a stage of anger, everybody reacts in anger, and this becomes a very, very important aspect in understanding how to take the rubric from anger and how to get to the remedy. So, hello, Dr. Jack. Anger. Now, simple, if you see anger remedies, there are a lot of anger remedies. In general, if you see, we have Noxomica, arsenic, anacardium, bryonia, Moxol, Lycopodium, Chamomilla, Natramure, Aconite, or Metallicum. Lot of anger remedies. Now we'll try to understand how does anger manifest because of the miasm and how to interpret that anger in rubric form, and then how to arrive at a simillimum. Good afternoon, Dr. Bharti. Dr. Bharat, sorry. So some patients will come and tell you, Doctor Sahab, I am very angry. But whenever when I'm angry, I don't speak. If I get angry, I close the door and sit maybe for 1 day, maybe for 2 days, maybe for 10 days, maybe for months also. When I'm angry, I don't speak. And then the case proceeds. Now, this is a very, very important indication of a remedy in anger. Try to interpret this symptom into a rubric form first and try to get about 5-6 remedies. For example, yes, Dr. Ganesh, I just come to your question. So this is called as anger and talk indisposed to. In anger, the patient does not talk. So we have remedies like ignitia, veratrum, pulsatilla, natramure, petroleum, ammonium mure, where the patient does not speak in anger, maybe for days, for hours, for months also sometimes. That is the answer to this part of symptom of the patient. So there's a question, tuberculosis homeopathy से क्योर किया नहीं होता है सर? Basically, according to the government protocol, every tuberculosis patient has to be registered in the tertiary care GMCs in GMC. So if you're treating a case of tuberculosis and something goes wrong, then it is basically not good. So patients who come to us, basically those patients who come to me are basically patients who are already taking tuberculosis treatment and they are not better, or they have taken the whole course but still the symptoms and the disease persist. So maybe resistant tuberculosis or patient not responding well to the treatment, they come to us and they are much better with our treatment. Of course, they are already taking these anti-tuberculosis medicine also. This is my answer. Good afternoon, Dr. Abhishek, Dr. Babel, hello. So this is one part of anger. Sometimes the patient, okay, so I'll just take one more question. Sir, need opinion about lipoma, sir. I have seen that after perfect simulum, all things getting cure, but no chances in lipoma. Your opinion? Yes. So lipoma, I have also few cases which have responded very well to the treatment, but there are few cases which are not responding well to the treatment. In most of the cases I have seen it takes a bit time for the lipoma to have some recovery. So please continue the medicine. There are some specifics for lipoma, but I don't use specifics because there is a different condition where lipoma occurs. It is accumulation. So it is miasm psychosis. So I would basically go to antipsychotic medicine and try to prescribe the medicine. I have seen in my practice, though people use thiocyanamine as a regular for lipoma, but I have seen if you are taking a case, you have repetized the case, you have got the remedy and the remedy is not working properly, give a dose of thiocyanamine 1 potency and just wait for the medicine to act. Your polycrest remedy which you have given or whatever simillimum you have given will start acting again. This is the first part. Second part, which are with a very strong psychotic history. For example, if the father and mother have a very strong psychotic history, then medorinum, thuja and natrum sulf works better as an intercurrent in this type of cases. In my experience, whatever cases I have been treating for lipoma, most of the time the remedy is right. But a point comes where nothing works, nothing moves forward, and that's a time to think of these few remedies. That is my opinion in treating lipoma. Though I have definitely cured few cases of lipoma, all the nodes have been gone. Okay. Sir, potencies and repetition of remedy in delirium cases. There's just one answer I will give you. If your remedy is right, you will see a change in the patient, and depending upon how much is the change, you have to decide how to repeat the remedy. So, if possible, give LM potency. Okay. In delirium, I have seen in my practice, inhalation also works very nice. So, how to treat acute like diarrhea, conflict, because time is less in this? A very good question. In our early practice, we get cases of diarrhea, dysentery, and a lot of acute cases. And it is very important, my friend, to treat these cases because the patient has to gain confidence in you. Once the patient thinks that the doctor can cure this disease also, so he will come with some grave disease or with reference with some other disease. If you are not able to treat these cases, the patient says he is not able to treat diarrhea and cough and cold, so what he will treat? Asthma or tumors or BP or blood pressure or sugar. So in this case, I have seen in my practice now that LM potency works better because we have to do repetition. Secondly, the doctor, the starter, who have started the practice have very much anxiety and anticipation. Will this one dose or two dose work? So they basically want to repeat medicine. This is my opinion. I've seen in my practice. So in this type of patients, you make sure that you give LM potency so that you can repeat, and call the patient after 2 or 3 days. Don't give him a 15 days medicine because he does not know whether it's working or not. If it is not working, he'll go to some allopathy doctor and cure his case. If you give for 3 days, he'll come back to you. So LM potency is nice. And for acute like diarrhea, dysentery, cough and cold, make a chart on your own. For diarrhea, painful, painless. Diarrhea, offensiveness and non-offensive. Diarrhea, putrid. Diarrhea with offensive, which type of smell. Diarrhea after eating heavy food. Diarrhea after. So make a chart in your paper only so that it is very easy for you to refer. Otherwise, most of the time we start with either arsenic or ipecac or podophyllum, and sometimes it works and sometimes it does not work also. So make a chart in your clinic only and just refer to that chart so that you treat that patient better. Medicines for osteitis of forehead. Abhishek, see, if you want to understand that osteitis and there's a specific medicine, I would say that you have to first think, see whether the osteitis is, what is the patient, how is the patient taking that disease? What is he feeling? He feels, doctor, I have osteitis and I feel that I have a lot of inferiority complex going in front of people. What will the people say? Or I'm fed up of this osteitis because a lot of people give me different opinions of what is this, please do go to this doctor, go to this doctor. So he's very angry and XYZ. So how does the patient behave because of this osteitis means inflammation of the bone. So make sure that you take the reaction of the patient. Otherwise, in lot of cases I have seen in my practice, sometimes the routine medicines like Symphytum, like Moxol, like Asafoetida, like Calcarea, like Anacardium, they give very good results. Your opinion, flower medicines, Suhana. See, flower medicines I have used very sporadically in my practice. Few remedies like aspirin or crabapple and all I have used in my practice, but I would not be able to give a definite opinion on this because I have used that very sporadically. Okay. Sir, whenever time permits, please share and guide how to treat simple acute cough cold with example of cases. Yeah, if you have been following me now, I have taken a lot of acute cough cold coryza in my YouTube also, in my YouTube live also, and I have made some videos on cough, exhaustive videos on cough, 1 hour or 2 hours. So you can go to my YouTube channel and find out cough acute. You will get a lot of remedies and differentiating feature of the remedies, how to differentiate between cough. I think it is there on the YouTube and Instagram. So I was talking about something about anger, if there are no questions now. So I was telling, yes, anger, talk indisposed to second. And sometimes the patient comes and tells you, sir, I get angry very easily, but immediately I feel that I have done something wrong and I say sorry. This is also a very interesting symptom which the patient has told you. Don't just pass on this symptom, okay, it's okay, he's good, he tells sorry. But we have certain remedies who are very quick to tell sorry. Do you think of any rubric where what I am talking about? The patient says, I get angry very easily, but I say also sorry very fast. So everything is sorted very fast. Believe me, there is a remedy called as lysine. And you must have heard lysine is prepared from the saliva of the rabid dog, and very angry, manipulative, shouts, screams. But my dear friend, lysine is a remedy which says sorry also very quickly. And the rubric that you must think about is anger alternating with quick repentance. I have used lysine in so many cases with wonderful results. So anger alternating with quick repentance, think of lysine, think of sulfur, and just think of one more remedy, that is vinca minor. These three remedies I have used in my practice with very good results. All anger alternating with quick repentance. Sir, sometimes only common symptoms are there in acute. How to deal in the type of cases? Very nice. Sometimes the patient only comes to you, doctor, I have only diarrhea and that is for 1 day and there are no other symptoms. Ask, how is the diarrhea? Whether it is offensive, whether it is non-offensive. So you can differentiate between the smell, the offensiveness, or diarrhea is because of exposure to eating, food which are fatty, exposure to eating oily food, exposure to eating water. Something has to be there, my dear friend. Nothing is like falling off an apple like Newton. Everything has a cause. Or the patient has a chronic diabetes, he also suffers from recurrent diarrhea. So these are very, very important symptoms, 1 or 2 symptoms. In acute, only 1 or 2 symptoms and you can crack the case very easily. So make sure that you give some at least 5-10 minutes to the patient for asking the symptoms and you will get the remedy right. Medicines to increase joint, before that, chilliness without any fever. I think I've answered this question before also. Chilliness could be a basic symptom also. The patient is absolutely in. There's a sentence called lack of animal heat, alumina and kali hours, or the patient is suffering from sarcopenia, this is all chilly. Old age, the patient is chilly. So these are this is a very vague question. I've answered this question before also. Medicines to increase joint motility. See, medicines to increase joint motility, first of all, you have to understand why the joint has become stiff. Then you will increase the motility, no? So it happens in a lot of diseases, arthritis, HLB, 27, acute disease, synovitis, sinusitis, lot of synovitis, lot of this. So first understand why it is and what are the symptoms. Stiffness in the morning, stiffness before stretching, lot of other symptoms. So you can think about guaiacum, you can think about kali iode, you can think about macphos, you can think about salicylic acid, you can think about rust tox, you can think about simisifuga, lots of remedies. Sir, osteoarthritis is curable homeopathic medicine or palliative? First of all, let me tell you that in homeopathy, if your simillimum is correct, if you have taken a good case and your simillimum is right, if we can cure cancer, I am a mentor for the Cancer Academy in Batra, and I have cases where I have cured cancer with only homeopathy medicines. So curing is okay. We can, if you have a right simillimum. Osteoarthritis definitely is curable homeopathy medicine. It only depends on how is the patient come to you. Most of the patient comes to us by taking allopathy medicines and they've exhausted everything. They are on steroids, they are on HCQs, they are on disease modifying agents, and they come to us. And after 1 month, they come and say, Doctor Sahab, there is no change. Homeopathy does not work properly or what? So you have to tell the patient you have been taking these medicines for years and you have not got any change. So how do you expect change from us? In this case, you have to be very, very, observatory, because these changes first will not come in the pain and the joints. This first change will come in the patient's mental attitude, behavior, temperament. If you find that the patient, for example, the patient had come to me and he used to tell me, sir, I have very bad dreams, as if I'm drowning, the water is all black and nobody to pull me out. But after the medicine of he was a case of osteoarthritis. After the medicine, she said that, sir, now pain is still there, the stiffness is still there. I'm taking allopathy medicines also, but now I have dream where I'm swimming in water and I'm coming out of the water safely. That means that my medicine is right. In this case, please wait and just continue the placebo, so that the patient is coming out from the mind, the body will also come back. Don't change the medicine just because the pain and the swelling and the arthritis is not good. Ask how is the patient feeling, whether mentally, the dreams, behavior, attitude. Ask the associates, and then you can change the medicine or change the potency. I hope you understood. If you get the answer, if you are happy, just tell me that you are happy and just give me a thumbs up, so I know that you are understanding what I want to tell you. Frozen shoulder, we have already completed that question. Sir, cold pack is good or bad? It depends on case to case, my dear friend. Frozen shoulder is because of diabetes mellitus, so please control the sugar first. And this I have already explained in before 2 or 3 YouTube, so please go and see that. Okay. Alexandra, welcome. Good morning. Which remedy is for a case of sudden pericardial effusion with a history of static hepatopathy and left adrenal atrophy? Okay, so a very nice case. And pericardial effusion, if you see the books of medicines, if you see the books of Mater Medica, this is a very, very interesting, there are very interesting remedies. But then you have to understand when is those effusion symptoms more. For example, a patient had come with pericarditis inflammation. Of course, the patient had a classical symptom that whenever he lies down, he feels better. So I had prescribed that patient Soranam, and the patient improved very well. So if you could get a modality of this complaints of this effusion, then it would be very much better. Don't always give remedy written for sudden and start aconite. I have seen it does not work because of just only of suddenness. Now the patient has come with a pathology of pericardial effusion. So there are 3-4 remedies that are very, very useful. I've seen in my practice. Of course, aconite is there, but just don't give aconite because he has sudden symptoms. Okay. First, think about the remedy I gave is arsenic album. You must first think about arsenic album. Second, think about spigelia. Third, think about veratrum viridi. Especially the patient says that because of this, he has a lot of congestion in the head feels heavy, he holds the head and has to sit. Veratrum viridi has given me very, very good results in my practice with this symptom. And of course, the patient comes with, with the dropsy and all, then think about digitalis and sulfur also. I hope this is okay. Dark red tongue. Now, see, if it is a case of pericardial effusion and effusion with history of hepatopathy and left renal atrophy. That means miasmatically, if you see the case, basically the organs are getting involved now. When the organs are getting involved, there is a lot of congestion because of all this complaint, and that's why the tongue becomes dark red. So in this case, there are few medicines which are important. Of the first you must think about in this case is Bryonia alba and Apis mellifica. And if the case matches with your adrenal atrophy and all, give Apis mellifica in LM potency and start by 0/4. And that will give good results. Repetition. If you don't have Apis 0/4, start with 0/1, only one globule, 100 ml water, 10 stroke. From that, take 1 spoon in half cup of water, and from that, cup of water, take 1 spoon, and then you will get good results. In this case, the diluted dose and repetition would give good results. So tongue is dark. I hope something you got about from this. If not, then I can further explain. Just write something so that a lot of questions have scrolled up. Which medicine homeopathy as a blood thinner? No, I don't know. I have not given this as a patent for blood thinning. Sir, repertory is very confusing, like beginning of motion aggravation, and it is confusing if you put a lot of symptoms in the repertory. Those who are working with me and those who have seen me in my practice, if you put a lot of symptoms in the repertory, whatever the patient tells you, you'd only get the polycrest remedies. And the more the symptom you start putting, the more confusing it becomes, because then you get only those 5-6 remedies. So whatever you put in the repertory chart or the computer, make sure that symptom, again I'm telling you, is a defining feature of the patient's personality or the defining symptoms of the patient's disease. For example, we had a case of migraine. In the patient had come in November. One of my fellow doctors had taken the case. We had the boy had migraine for years and years with no change. We had prescribed the patient Corallium rubrum 1 mg single dose. The day he took that dose, Corallium rubrum, in November, I think 15-16, he came yesterday, no attacks of migraine. If you open Corallium rubrum, there are no symptoms of migraine or headache. I also don't remember which symptom I had taken, because yesterday only the patient had come, but I'll tell you in the next YouTube. I'll ask my assistant which symptom we had taken. But this is the beauty of homeopathy. Your case taking has to be so good, or your understanding of the patient's personality and then converting into a rubric form has to be good, so that you're able to define the patient, summarize the patient in a bird's eye view. So make sure that whatever, of course, this is how I teach to my students and this is how I practice, and then you'll be able to give remedies which you are never thought of. For example, Corallium rubrum. Okay, so let us go forward. Alex, I hope you, it's a very interesting case, Dr. Alexandra. I hope you take few details and give the remedy, because treating this type of cases really gives us satisfaction that we have done something, in our practice. Yeah, so okay, sudden shaking, trembling, twisting of limbs, drooling, not eating, weak, labored breathing, head hanging down, very restless, panting, ear dark red, hands and feet extremely cold. Okay, so I just did not read this, Dr. Alex. Yes, so now the patient is as good as a state where there is a defective vitality, and there is uneven distribution of body's energy, or you can say vital force in the body. One part is cold and one part is hot. This is a very, very interesting symptom, because now we have come to a stage. Now remember this, now we have come to a stage where the body's vitality is giving up. The body is trying to fight, but the body is not trying to fight, but not coming out of that situation. In this case, just remember one more remedy which I did not look at this symptom and I forgot. One more remedy, that is aurum muraticum. Please think about aurum muraticum also in this case, because these type of cases where the vitality is very low and the vital force, I could say the vital force now is sinking. And then if you have these type of symptoms, aurum metallicum works very well. So I did not see that, and that's why just add aurum metallicum. Otherwise, whatever remedy I have told you, it would work on that. I hope you got this right. Aurum mure. Muscular weakness in diabetes is a very, very common symptom, Doctor. Please treat. No, aurum mure, Dr. Alex. Aurum mure, not aurum met. Aurum muraticum. Aurum muraticum is a very, this is what, now you see, aurum muraticum basically is a remedy which I have seen. Just remember the symptom which I have seen. I don't know what is given in the repertory, but the patient is very idealistic and the patient is very responsible. And third symptom is horrible things affect them profoundly. I had a case where I had given calcarea carb and the remedy was working but not curing that case. In that case, then I was reading the Mater Medica, I came to know that aurum muraticum has this symptom of adolescence, responsible and horrible things affect them profoundly, and aurum muraticum cured that case. So just to give the reference on how I came to aurum muraticum, it was not directly on the first instance, it was on the second part where calcareca failed. I was reading Mater Medica and I got this symptom of aurum mur, responsibility, idealistic, and horrible things affect him profoundly. Yeah, I hope, Alex, that was it. Sir, mind is tricky. There are so many meaning of patient's words. How to solve this? Yes, yes, yes. No, digitalis intercurrent, I have never tried digitalis intercurrent remedy in my cases, but I would basically give remedies like I told you, or a muraticum, or you can think about some remedies. I had a case where the case, of course, did not respond as I wanted, but he was partially better with whatever medicines I gave. So I had given that patient's intercurrent remedy, simple Nux Vomica. The patient improved well, but it was not cured. He lived for some years and then he expired. But Nux Vomica I gave as an intercurrent remedy. Sir, mind is very tricky, and gradually in your practice you'll come to know by seeing patients, by taking a case, that you are able to understand mind properly. After 30 years also, if you ask me that the case taking has been done and I am very sure about the remedy, he will get better, it is sometimes difficult because it's a process. So I have an experience of 30 years, so I can read it better. So the students who are with me, they have time to read because of lack of experience. Rubrics, a lot of doctors know, but how to apply that rubric is important. In nowadays, there are a lot of application of rubrics. Different schools have different applications of rubric. In our times, we had only Kent repertory, and we were supposed to be lucky because Kent had only 100 pages of mind. So we had read all that pages. So it was difficult, easy at that time. But now we have repertories which have thousands of pages of mind. So our understanding also have to get upgraded day by day. So please keep repeating repertory, learning repertory. I find difficult to repetize adrenal atrophy. Yeah, actually, Dr. Alexandra, I'll just give you one example. I have a case of adrenal insufficiency in my homeopathy. She is better. She was on steroids, but now steroids have tapered off. In that case, Dr. Alexandra, I had given the patient adrenal cortex LM potency. I had given adrenal cortex LM potency. And the patient is better. She's still with me and she's happy with that, though she's taking few allopathy medicines also. But the doctor is also happy and I'm also happy because she's off the steroids. Adrenal cortex LM potency. Now she's taking adrenal cortex LM 0/9. So I have tapered it off, weekly once, sometimes once in 15 days, adrenal cortex. Okay. That was a very rare prescription and a rare case, so I did not tell that. But otherwise, because if you're finding it difficult, then I have added that. Sometimes, you have to plan to come to my OPD, so some rare prescriptions also would work better. Let us go forward. I used hepatitis as I can't find nodule of cyst. Okay. Sir, medicines to support hirsutism. Hirsutism is basically a hormonal problem. So no, I will not be able to tell you a remedy is guarantee that give this remedy and it will work. Though I have been taught by some doctors that give this remedy for hirsutism, it has never worked. Take a whole case because the patient is suffering from PCOS. It's a syndrome. So take the case and automatically the patient starts getting better. So please take the whole case. I cannot give a specific medicine for that. Anxiety, fear of death, क्यों लगता है? See, why there is fear of death, if we can't answer that, go to the Sora stage and ask him why there is anxiety and why there is fear of death. If you get the soric symptom right, automatically the psychosis and syphilis will fall in place. Okay? It's okay? I hope Dr. Mayura, sorry. Adrenal. Do tell what happened in that case, Dr. Alexander. It's a very interesting case. I always tell that you have to be lucky to get these type of cases in your practice. Drowsiness in depression medicine. I did not get the question right. But depression has to always have a cause. Try to find out why the patient is depressed, then you can proceed in this case. So thank you so much. Already half an hour up, and thank you for joining me. And I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Saturday, goodbye.